in regards to reproductive health information to be disseminated in schools?
Thank you so much, Julius Buchana. As we do understand, during this COVID situation, so many cases of early pregnancies, most especially for teenagers, came through, and of course the numbers were skyrocketing. So many civil society organizations came through to push for the National Health School Policy, giving evidence that it could actually solve this problem. Now, of course, joining me to dissect this conversation is Annah Kukundakwe, who works with the Center for Health, Human Rights and Development for Young People, and she's also into advocacy for sexual reproductive health and rights. Annah Kukundakwe, we need to understand what is the severity of the problem when we are addressing sexual reproductive health and rights for young people.
Okay, first of all, when you talk about young people, you need to understand that you're talking about nearly 70% of Uganda's population. So this very young population continue to grapple with a lot of sexual and reproductive health and related challenges. A few of those is the teenage pregnancy that you talked about. The media reports that indicate that in northern Uganda, 10,000 girls have gotten pregnant only during this COVID period, So that is only one region. So you can imagine what is happening in the western district of the country, which is happening in the central, and where everything that is happening everywhere. You talk about the girls that are continuously become defiled, become defiled, raped by those who are supposed to be protecting them, the parents, their teachers, when schools were still reopening. So it's very important that all these problems that we're talking about, and of course not forgetting that teenage pregnancy contributes as a substantive proportion of the maternal mortalities and morbidities in this country. So when we talk about young people and sexual and reproductive health, you need to look at a huge population that is at risk. We
need to understand, though, where is the gap? Where is the missing link?
I think when we talk about the missing link, you're talking about there has to be information. Sexual and reproductive, as a young person grows, they need to know all the information pertaining to sexual and reproductive health and rights. They need to have everybody doing the role, their parents giving them capacitated enough to give them information regarding their sexuality. You need to talk about a progressive legal and policy environment, where we have the relevant policies drafted, passed, implemented, and very well monitored,
I think that is going to usher us into the discussion of the National Health School Policy. Why is it receiving so much resistance, not only even in the delay to pass it, but also some religious leaders, even some school heads actually coming up to resist this National Health School Policy? If you could just highlight a few things that are in this policy, maybe for someone out there watching to get to understand.
The draft school health policy that has been a draft for the last 19 years. There has been a draft for the last 19 years, which is aimed at promoting health learning, health learning in the schools. So it attempts to address issues of school health that stretch beyond sexual and reproductive health and rights. It addresses issues of malaria, diarrhea, mental health, all those, but it's not comprehensive enough to even deal with the realistic challenges of the young people. But of course, why it has delayed to be passed, number one, it could be because it's not a priority according to the different governments ministry that are supposed to pass it, because when we wanted to pass the age limit bill, we did not even sleep. The next day it had been passed, So the issue of non-prioritization, but also, and you can even see with the first reopening of schools, is that the different guidelines that the Ministry of Education and the operation standard procedures that the Ministry of Health have drafted are only limited to COVID-19. They are not looking at the other sexual reproductive health and rights issues. So that's why I'm saying that sexual and reproductive health and rights are not prioritized. And that is no wonder we continue to see the skyrocketing teenage pregnancies, the pregnancy-related complications that young people continue to suffer. And we normalize the conversation. We say that 1 in 4 girls is already pregnant by their 19th birthday, or they've had their first child. And the conversation is normal,
So if at all government is delaying to pass this policy, don't you think you as civil society organizations that are pushing for this policy maybe are going wrong somewhere? What is that you feel the government is neglecting, or that the government is not seeing, or that call for urgency that everyone else is not seeing to delay the passing of this policy?
I think civil society organizations have done their role. They've created the evidence, done researches to present that, to make the case for the school health policy. We've had the media amplify the voices of the young people and the very enormous challenges that these young people are facing. So we've gone ahead to actually have engagements with the government and accorded them the support that we think they require. So it's an issue of our decision makers accepting or consider this as an urgency, the same way we are worried and giving all the attention COVID requires. It's the same way we should give to sexual and reproductive health and rights and passing relevant policies.
Julius Buchana, you have it right there from Annah Kukundakwe. And of course, she is an activist for sexual reproductive health and rights. But I think the biggest question from this particular discussion would be, for how long are we going to stand seeing the skyrocketing numbers of young people dying because of basic sexual reproductive health and rights related issues? Back to you at the Political Command Center, Julius Buchana.
Thank you so much, Olivier Nakalembe, for that wonderful discussion.